in this discussion of bloodless surgery, there are some guidelines we need. I know what blood is and blood products is, but what's acceptable by people who are concerned about using less or no blood procedure? What would you recommend to say that would be reasonable for these people to accept?
The guidelines are as follows. Platelets would not be accepted, white blood cells not accepted, whole blood, and concentrated blood, red cells. And a lot of what I'm about to say depends upon individual witnesses. I mean, in other words, there are issues where the individual witness can decide for themselves what they want. In most instances that we have found, things like cryoprecipitate, which is an important clotting factor for children. Factor deficiencies, for example, giving factor VIII to hemophiliacs. These are particular, quote, blood products that by and large the Jehovah's Witness community will accept. So it's very important for people to understand. When we said no blood or blood products, it doesn't necessarily cover the whole spectrum of those things that hematologists and doctors have in their armamentarium to stop or prevent blood loss.
Well, sometimes you can draw blood from the individual before the surgery, store their own blood. Could you use that blood in surgery?
The answer is no. The answer is that once blood leaves the body, it is not considered acceptable to give it back to that individual. The only time it's I wouldn't say it's an exception is we mention this business of the cell saver. If you're in the field where the child is being operated on, let's say for open heart surgery, and there's blood in the field, and it basically is taken out of the chest and brought right back into the pump to the patient, that's acceptable. Remember, when a lot of the interpretations were done, and it continues to evolve, a lot of these techniques were not necessarily available. So as time goes on, we as a medical community, working alongside the Hospital Liaison Committee, working alongside the Jehovah's Witness community, as new things develop, we work with them to try to come up with the most appropriate types of therapies that we can use. Jehovah's Witness community, I mean, the scientific body of knowledge that they have is remarkable. And they are always open to dialogue between the medical community and themselves.